Let's get into nurse education and instructing. So you are a nurse educator for undergraduate nursing students, right?
That's correct.
And are you doing both classroom and clinical right now?
Yes, that is correct.
Okay.
Doing both classroom, which we call theory or didactic, and then also clinical instruction.
Okay. And I haven't been to nursing school for, a while now, but we were talking about before how schools are using a new method of curriculum called concept-based curriculum. Can you just explain what that is and how it's different than what used to be taught?
Absolutely. So we transitioned from the traditional curriculum, which we felt mimicked very much the medical model, and transitioned to a concept-based curriculum, which is a lot more nursing-friendly. So now we took the information from pretty much looking at it from systems point of view, and now we're looking at it in terms of concepts. And so it's more digestible right now for students, and it's easier for us faculty to teach as well. And also clinically as nurses, we've been doing this. When we're dealing with a patient, we apply concepts. It's like, okay, oxygenation, communication, right? So we just brought that ideology to the classroom, and it's really making a lot more sense for the students.
So what type of, name some of the classes that you're doing now?
Okay. That I'm specifically teaching in, or
that's part of this concept-based curriculum.
So all the classes right now are part of this concept-based. You remember, Maggie, in our time when we were in nursing school, we took pharmacology as a standalone course. In this concept-based curriculum, pharmacology is no longer a standalone course. It's now broken into concepts and applied with each course as it applies to the particular course. So for example, right now I'm coordinating and teaching health assessment. So we're learning in concepts, communication, oxygenation, sensory perception, things like that.
Wow.
Yeah.
That's so different.
I know. And Maggie, would you agree with me, for example, the concept of oxygenation, would you agree that regardless of the course that you're taking, that oxygenation applies to everything?
I mean, yeah. It definitely does. That's going to be interesting. I wonder how we can kind of evaluate the, teaching strategy for nurses that are going to be coming in, how they think differently.
Yes.
I feel like it's really easy for nursing, new grad nurses to be very, I don't know, cut and dry and textbook and task oriented. And I wonder if that's going to help.
I think it helps. Yeah, I think it helps. I mean, I've spoken to students about it, and generally, they said yes, that they feel that this new concept-based curriculum is helpful. It's more digestible. It's more practical. So yeah, we're seeing great results with it. Yeah.
Do you feel so you'll have one whole course on oxygenation?
Not the whole course, but there will be concepts in each course. You could have the concept of oxygenation in multiple courses. Okay. Does that make sense?
Yeah, it makes sense. So then I'm just curious as to what, how the courses are structured. Do you still structure it women's health?
Absolutely.
Pediatrics?
Yes.
Okay.
Yes, we still do it that way, but we just learn it in concepts.
Okay. Gotcha.
Or teach it in concepts.
Yeah. It's such a, I can't even wrap my head around. I'll have to go to a class or something to understand how I'm sure that it's taught so differently than how I was taught 10 years ago.
It's the same material. It's
sure.
broken down in concepts. Yep.
Yeah.
Yep.
Because the things that would stick in school was how you would apply it.
Exactly.
So I feel that teaching strategy must help students really nail in what they're trying to understand when you're thinking about it concept wise.
Exactly.